Welcome to Domain 3 Essentials, Patient Safety and Quality Assurance with Jamie McGuire. Jamie has been the Pharmacy Technician Program Director with WVJC Online for the past 10 years and is responsible for the development of a fully online advanced degree program. Jamie's been working in the healthcare field for 25 years, 10 of them as a health system pharmacy technician. She thrived in the fast-paced world of hospital pharmacy, where she specialized in ICU, anesthesia and operating room, pediatrics, emergency services, and then finally sterile and chemotherapy compounding. As an advocate for the advancement of pharmacy technicians, she sought out a career in education to fulfill her personal commitment to the field of pharmacy. Please welcome Jamie McGuire.
Hello and welcome. My name is Jamie McGuire, and I'm going to be talking today on Domain 3, specifically patient safety and quality assurance. So what I wanted to present today about is the knowledge of patient safety and quality assurance versus how we practice patient safety and quality assurance. So what I want to do for you today is kind of rationalize that role and what our expectation is as far as what is required on the exam, what knowledge and the vast knowledge that's included, but also how as new technicians and student technicians can incorporate this vast knowledge into practice, and how you can build this day to day through your responsibilities by identifying different tasks and techniques to get you started. So first, we're going to look at the exam and those knowledge expectations that you're probably very familiar with right now. Give you some tips on what to focus on and how this is going to relate to test taking versus what you're going to be doing in the field, and how you can use your resources and tools to utilize it. We're also going to look at the rationale. Why is there so much information? Why is there so much knowledge that is expected of us as pharmacy technicians? And how can we understand and grow from that background information? And then I'm going to really focus on giving us a scenario to look at. And one of the most common scenarios I can think of is, the medication fill process. While we are actually filling a medication, what are steps that we can take to incorporate this patient safety quality assurance tasks and responsibilities that we have. So let's first start with knowledge. So there is a vast amount of facts and information related to Domain 3. And one of the biggest things that I constantly want to impress upon my students is what is common sense versus what is the expectation. So I think a lot of individuals come into this thinking that it's going to be common sense on what we're doing to keep a patient safe. So when I see questions on the exam, it should be pretty obvious what's the right answer and what's the wrong answer. But I can tell you that's not technically going to be the reality of the situation, because of how we approach patient safety from a more of a data collection. So let me explain a little bit by looking at Domain 3. So I don't want you to be deceived by this information and then just assume that, going into it, that you're going to be prepared without really putting some effort into it. So what I've collected here are the main objectives behind Domain 3 as far as, certification exam goes. I'm sure a lot of students are very familiar with, patient rights, how the 5 to 7 rights of patient medication administration, your high alerts, your sound alike lookalikes. These are actually a really good example of how we can assume versus how we can prepare. Sound alike lookalike medications. When you're given options and you have not properly prepared, you can easily get a exam question incorrect because what you're given could be a list of medications that sound and look alike. But the reality of the situation is these are based off of our error reporting. Sorry, I want to pause there and go back. So when we are looking at look-alike, sound-alike medications, it's easy to be deceived by the possible question and answers that we're given because the examples that we're going to be given are possibly all sound alike, look alike. But the information that is pulled and the data that's collected that identifies a sound alike, look alike medication is based on medication errors that have actually happened. So you could be looking at a possible answer that looks like, yeah, that's going to be it. That sounds like, and that has a very similar look to each other. But the actual question is based off of the fact of the ISMP list that's been generated through the medication error reporting. And so really what you need to do is put the effort into, reviewing that list of sound like look-alike medications. So that's a lot of domain 3. There's a lot of facts based off of evidence of the medication error reporting. And so it's easy to be deceived that this may be common sense and I can go in and I can get the right answer just based off that. But you've got to think about all of the background that has gone into actually collecting this information. So it's also important, obviously, to understand all the different types of medication errors, the causes, the characteristics, what happens at the outcome of each of these medication errors. And there's a vast amount of agencies and organizations and standards and laws that go into reducing the prescription errors. All of the processes of the medication fill process is also included in this. So even though this is something that we see again in domain 4, we have to also consider it from the patient safety side of things, all of the standards that exist to ensure that from the pharmacist intervention all the way to counseling, services that we put in place like medication therapy management and medication reconciliation. These steps have been and processes have been put together to kind of reduce the amount of errors that occur. Of course, we have organizations and processes that go into the event reporting procedures and tracking. Another area that's included in domain 3 are root cause analysis. So this really has us looking at how we can improve upon our processes, how we can do better, and how we can continue to grow to do better and keep our patients safe and to reduce the amount of medication errors. We have our REMs. So this is protocols that are put in place to help mitigate the risk that's involved in certain medications or certain treatments or combinations of treatments. And then the things like our technologies and our robotics and automation that we also utilize to help maintain our limitations on risk and medication error. And then also included is our environment, so infection control, how we're trained, the competencies and evaluations that we do annually, the equipment and how that equipment is also annually maintained. And so there's a lot of information involved in this specific knowledge area. So it can be overwhelming in a way, as especially a new pharmacy technician going into the field on, oh my gosh, that's a lot of information. How am I ever going to actually apply this? How am I ever going to remember this? Is this all on me to carry out? Am I supposed to know how to apply all this information and all this knowledge when I get into the field? A lot of my new students are just focused on getting through, a simple medication fill of a simple prescription. So before we get to looking at what that would look like for you, I want to take some time and look at the background, the bigger picture. So the what, where, and why of Domain 3. Where does this come from? Why is it so vast? What is the bigger picture and all the components involved in it, and it can help you understand why there is so much expectation on the knowledge part of it. And then we'll bring it back to kind of more of a realistic, step by step, what you can do to be practical, but also to incorporate all of this knowledge. So first, of course, we cannot, go through and talk about patient safety and quality assurance without talking about what is a medication error, because this honestly has become the reality of, patient safety is prevention of medication error. Now, it's not the pharmacy's intention to, spend the vast amount of time keeping patients safe from medication errors. We ideally don't want any errors to occur at all. We would like to proceed, doing our job in enhancing the health and treatment of our patients, enhancing the services that we can provide them. But for now, we really need to play our part in, keeping our patients as safe as possible, making sure that we can provide them the pharmacy services that they can trust. And so with that is doing everything in our power to reduce the amount of medication errors that occur. So when it comes to kind of understanding what this is, I went to the National Coordinating Council of Medication Error and Prevention, and it defines medication errors as any preventable event that may cause or lead to an inappropriate or medication use or patient harm. So while the medication is in the control of the healthcare professional, patient, or consumer. So it's our role to make this avoidable, to try, even like the healthcare professional stage of things, that is pretty straightforward. I mean, that's obvious. While it is still in the process of, the professionals, we want to do everything we can to reduce the chance of error of occurring. But when it becomes part of the, patient's role or the consumer's role, this gets a little more trickier. And this is where pharmacy has really stepped in to try and come up with protocols and procedures to educate patients, for a pharmacist to counsel with patients. So there's a lot of components involved there that go back to Domain 3. So where do these medication errors occur? Where does this patient safety, quality assurance, vast list of knowledge come from? When you look at globally and understand that unsafe medication practices and medication errors are a leading cause of injury, but not only the leading cause of injury, but an avoidable harm in the care system across the world. It becomes more apparent of how big the issue is and how much potential there is for us to play a part in preventing them. So you can see here there are several areas of potential for medication error to occur, not only within the healthcare professional, but also within medicine administration, medicine use, medicine practices. But then you have a whole area, especially expanding now, is when it gets to the patient in public. The advertisement of medication, the use of medication, the manufacturing of medication. And so these are all areas that become very complicated when you are asking patients to kind of make decisions based on limited information, and then asking doctors to and providers to do their best to help the patients, but also, limit potential risks and potential outcomes based on the limited information they may have, and then so on and so forth. So, there is so much potential for error to occur. And then when you compound that with the just in the process of prescribing, the variables that have to be considered for each individual patient, you can see why there are so many protocols, so many standards, so many areas of knowledge that we're expected to at least acknowledge exist, that domain 3 becomes a little more understandable. So when you're looking at the win, what we have here is kind of a brief overview of the medication prescribing use process. And all of these different tabs here are identifying another step in the process. This is actually a flow chart specifically referencing clinical pharmacology. So this is what our pharmacists are really doing. And this is really the background and bigger picture to pharmacy services. So our medication errors occur when there's a weakness within the medication system, and when there are human factors such as fatigue, poor environments. There can be conditions, of course, all of us or most of us can relate that have been in the field to shortages, not just staff shortages, but medication shortages. But all of these factors will affect the process, how we are prescribing, how we're transcribing the data and information, how we're dispensing, and then, of course, how administration is happening, and then how monitoring practices are happening. So there are vast amount of variables involved. So when you add all these up, you can see, there is a huge amount of knowledge required to keep patients safe, to give that good effort, and that's where the quality assurance comes in. So before we move on, let's take a look at, the combination of the complexities and the challenges and compounding them together, and this will kind of bring it full circle. So when you think of what our pharmacists and what our providers are doing, and all of the additional challenges of the patients and the administration process and the counseling process and the monitoring process, it all comes together to compound, and this really answers the question, why? Why do medication errors occur, and how easy is it for it to occur? So right here we could see all of these different external factors and including them with the regular internal factors, our regular process of prescribing and dispensing. So you combine those together, and really it becomes obvious of where those weaknesses may be. So again, bringing it back to how can I, as a pharmacy technician student, possibly help this scenario. And this might also bring an anxiety to how do I prevent myself from becoming part of the problem? And with that, we can look at simple ways for you to incorporate really simple patterns and trends in your day to day to help you not only avoid your own medication errors, but for you to, embrace evolving and becoming part of the solution. Now, before we look at opportunities for you to kind of put this into your regular routine and prepare for going out there and kind of setting yourself apart from the rest, we really need to look at what is quality assurance and how you can better understand it. It seems like it might be a more complicated area, but realistically, you can break this down and make it quite simple. So quality assurance is a system of procedures, activities, like protocols, operating procedures. We've got plenty of them: laws, standards, accreditations. All of these are oversights that are ensuring that the way a certain thing is happening, operational, and quality standards are being consistently met. And consistently is the key word here. A quality control is going to involve an opportunity for us to test, sample, and document the result of that. So what we're saying is, by having a quality assurance measure, this is the thing that we do, we can use quality control, which is the proof of that. And we can show that we are providing quality outcomes through this process. So where quality assurance is about how a process is performed or how possibly it is created, quality control is going to be more about how we manage it and how we prove it. Okay? So how can we practice this? And this is really what I wanted to get down to, because all of the variables, everything that we've talked about already and everything we've explored at this point, and the vast information that is included in domain 3, it seems overwhelming. So how can you take that information and apply it in your day-to-day? So taking a real-world scenario, which I think any new pharmacy technician can relate to, is the medication fill process. So let's look at that. So now we're going to look at the how. So what I've done, I've taken the medication fill process and simplified it. Now I know there's a lot of steps, and especially depending on what type of pharmacy setting you're in or what type of medication you're filling, whether it's a basic oral solid or compound. I want to just focus on the general practice of medication fill process and highlight the different opportunities that each of us have to bring in those quality assurance measures, to bring in those patient safety opportunities. And so we're just going to look at basic steps that are involved in that medication fill process. So, from the pharmacist verification from the very beginning, to receiving your prescription or order label, to filling that prescription or order label, the review of it, and then, of course, the delivery of it. So I would want to keep it simple for you and not go beyond that entry level opportunity. Of course, as each of us gain more knowledge, gain more experience, we're going to get better and better and grow as our career grows. So understand that, I'm just going to give easy tips to approach this at the beginning and then give you that opportunity to evolve from there. Now, before we get started, I want to give you some tips on things that you can do before you even get started in a new job. Maybe this is a new externship opportunity. These are tips that I give my own students before they even fill that first medication or that first prescription or that first order. These are things that are going to really set you up for success and help you become more organized and deliberate in the things that you're doing. One of the very first things, no matter if a student is going out for their meet and greet for externship for me, or this is their first day on the job, I really encourage them, if it's not already an opportunity offered, to really, be vocal or ask or request an opportunity for a tour. How the pharmacy is laid out, how it is organized. This is going to really assist you on how to find medications when you are filling them, if you know the layout and organization of the pharmacy itself. So get a tour. Where are different, and most of our pharmacies are laid out by, route of administration, of course, by, different inventory, whether it's hazardous inventory or controlled substance inventory. Regardless, knowing where these items are or how the layout is organized is going to give you initially a leg up. Otherwise, I've seen in new training, a technician walking around with a label looking for a medication for what seems like forever. But just having that general layout can help avoid those situations. Also, knowing how not only to access your pharmacy management software, but even if you have an opportunity to learn more about it, how to utilize it, how to find different pieces of information. As a program director, as an instructor, I've included curriculum in my program about this, but the thing about it is every type of pharmacy is going to utilize a different software. No matter how much exposure I give to students, and no matter what you've been able to do as a student yourself, it's not always going to be the same. Usually as instructors or, as trainers, we're trying to give you an opportunity to explore it, but that doesn't necessarily mean that you're going to be able to then, access any pharmacy software program and be able to navigate it effectively. So if you're able to ask for that opportunity on your first day or two, that will also give you a leg up. Knowing the workflow of that particular pharmacy is also helpful. Where things are laid out, what is the different order of things. The medication fill process is similar, but it isn't always carried out in the same way in every setting. So having an opportunity to either see the medication fill process happen from start to finish or have somebody explain what that looks like from start to finish can be incredibly helpful. So all of these things are allowing you an opportunity to not, question or try and fill in those spaces by yourself, and because that's where opportunity for medication errors can occur. Another big tip, where are those operating procedures? Every pharmacy has them, they have to be part of our, pharmacy information that's available, just like our safety data sheets, right? So our standards of operating procedures, where are those located? This can answer almost any question that you might come up against. One of the things that gave me a leg up as a new technician is knowing this and being able to reference it in situations that were new. As pharmacies, we're open 24/7, and our management is not always available right there to ask those questions. But if we know where to find those answers, that can be extremely helpful. So, from the very beginning, knowing where those are located, how they're organized, what type of information is in there, can be extremely helpful. And identifying roles. If you know who is responsible for what, and it can also help you relieve those worries of, what am I supposed to do? What is my role? For example, when I worked at a big healthcare system, I didn't know immediately, but later found out that there was a pharmacist whose specific role was responsible for doing the error reporting. So there was one individual that was responsible for filing and reporting medication errors. And so that, once I realized that, I was like, well, that makes me feel, a lot better. And now that I understand that, I know there is an individual that I can, not only can I provide information, but I knew that's happening. And when I'm seeing medication errors, or if I come across medication errors, I don't know what to do. I understand the knowledge behind it, but to actually file one, like, that was kind of a big deal. But knowing that there was actually an individual already identified as the person who does this, who is responsible for doing this, made a big difference. So knowing the roles of individuals and knowing who plays what part can also be really helpful in you understanding what your part is in this process. So those are some big tips I have for you starting out. So, going through and identifying what you can do. The pharmacist verification process, it's important to understand what their part is and what your part is. So what I kind of explain the pharmacist doing is really getting in the weeds of it. So when we looked at the flow chart earlier and we were looking at all those variables and seeing all those different factors involved in the medication use and practice process and the medication diagnosis, all the things involved in that. That's your pharmacist getting in the weeds of it, getting into the details of it. So hopefully at some point during your training or your education, you have heard the term ambiguous. And so ambiguous errors are something that we as technicians are accepting kind of a role in. So what does that mean? I like to kind of break down the word ambiguous and really that BIG, big, ambiguous, the big factors. So the big things, the bigger picture items that if you're in the weeds, you might not see them, right? So it's kind of like the tree for the forest situation. So identifying unique characteristics. When you're filling a particular medication that doesn't, play well with plastic material, so it has to go in a vial container or a glass container, or this certain type of compound that requires this very unique, maybe it needs a pH test when no other compounds require it. An insulin drip obviously would not be made in dextrose. So these obvious things we are preparing to identify when we're filling our prescription. Now, are you going to be able to identify every ambiguous error that comes across your way as you go? No, this is something that you're going to build as you go, but you have to be open to it. Ask questions, investigate, really engage. That's how you're going to really pick up on these opportunities to identify errors by being actively engaged, actively listening, paying attention, asking questions, just really absorbing as much as you can. And so that way, when it comes up again, or you have the opportunity to catch the same error, you'll be ready. So really, when it gets started, most of the medication fill process for the pharmacy technician starts with the either prescription label or the order label. So everything in this label is an opportunity for a clue, from the patient's name to their age to the medication, which is obvious, the signa or the directions for taking. A lot of our medication labels and order labels now come with all of the information that we could potentially need, including opportunities for auxiliary labels, opportunities for calculations. So, as our technology and our software grows, so does the information that's provided to us. So, your opportunity to really incorporate patient safety and quality assurance is by taking a moment and consuming the information on that label, taking a moment to understand the information that is being provided to you. Can you interpret everything on that label? Do you understand everything on that label? Is there anything new to you on that label that you've never come across before? So you may be able to go in and do your job and do it successfully just by doing XYZ, but is that really giving you the opportunity to grow and evolve? And quality assurance, this is where we can bring quality assurance in by doing the process, every step of it, every time, all the time. So one of the tips that I give my students is using a calculator. When you're doing your calculations, which you should be doing every time, even if the information or the solution is provided to you perhaps on the medication label, you should still be doing it every time. This is your part of the quality assurance, right? Even if that calculation is simple and you can do it in your head by using the calculator and getting the correct solution every time, whether it's 1 + 1 or, more complex. Doing it every time, that is quality assurance. Using the tools and the processes and doing it every time, no matter what, no matter how difficult or how easy. That is how we prove that we are bringing quality assurance and quality control to our products, to our outcomes, to our services. So when filling a prescription order, this obviously has a lot of steps involved, and I just want to give you a few tips on how you starting out can help yourself in keeping yourself on a certain direction, as well as maintaining that patient safety aspect. Always have either the original label or the original order with you when you are filling the medication. I don't know how many times I've seen possibly a new individual, they will leave the label and then go hunt for the drug, and how many times they have to come back to the label to review the information and hunt for the drug. Take that label with you. And so when you are identifying the appropriate medication, you have that label to compare it to, and always use whatever automation or technology available to you, such as barcoding, to ensure that you're using those assurances, those quality control assurances, to maintain that outcome. Review the fill prescription in order. So knowing what the expectation is, knowing what your pharmacy or what your setting or whatever it may be, because they're going to be different. Whether I am filling for a community pharmacy or I'm filling for a health system, how that fill process or how that review of the fill process looks is going to be slightly different. And packaging is everything. Hopefully, you have come across the term pharmaceutically elegant. This may seem like, just kind of like a cherry on top, but really, we are embracing good manufacturing procedures and protocols to ensure that the product that goes out would resemble, a product that would be purchased from a manufacturer. If I go into the grocery store and I'm purchasing something that's coming from the deli, it should look very much like the same products that are coming from other vendors. So taking in the consideration on how our packaging looks, how we are carrying out, for example, auxiliary labels. This is an art of being able to communicate to either a patient or a nurse without anybody there to identify things that they need to know, need to pay attention to, and important things. And so all of these, kind of little things that might not seem so important, but they're so easy for you to get in the habit of really, you know, making it part of your process, that if you start there and you only get better, that's going to really set you apart, and also make it so much easier for you to build off of, taking these simple things that you can do and then really, growing from there and getting an understanding of how you can participate in the more complex processes, maybe such as, reporting medication errors or carrying out the data entry processes, or, there's plenty of opportunities for growth in our field. And then, of course, delivery of prescription. This is probably one of the most key areas for us to really play a part and communicate or engage in that transition from the medication, from the health profession stage, to either what we call, the patient or the administration stage. This is where that medication leaves our realm and is now out there. What can we do in that stage to ensure, as much as possible, that once it's out of our hands, that the patient's going to be safe, the administration process of that medication is going to be safe? Is there any clues, anything that I can bring to my pharmacist or identify that can possibly, help them avoid an error from occurring? Maybe it's something subtle, and since you're the one that is engaging with either the consumer or the patient, that you can identify as an opportunity, I don't think maybe this patient really understands, how to administer this medication appropriately, or maybe there's something more here that we can educate on, or whatnot. But bringing that to the attention of your pharmacist, or even asking more about what opportunities there are, can give you a leg up, and again, help you evolve. So small things, staying observant, staying engaged, just listening, finding a mentor, and finding somebody that you kind of hone in on is like, oh, that person really knows what they're doing. They're really on top of it. I'm going to pay attention to what they're doing, and I'm going to, really pick up on those things. So overall, what can you do? How can you keep this simple? Um, know where the knowledge is kept. Okay. Every pharmacy has formularies. They have all of this written down. They have to. It's part of the requirements. So the standards, the laws, the requirements, the guidelines, whether it's USP or ISMP or, BOP, all of this information is documented, and it is somewhere. When knowing where it's located is a really important part, because do I expect that every one of my students is going to memorize everything that they come across in their courses? No, and even if they did, it's going to change in no time. What was is going to evolve and change. So really what I really encourage them to do is know their resources, know where their resources are located and how to access them and how to navigate them. Do every step every time. Every step, every time. This is key to quality assurance and those quality control outcomes. No matter how simple or how complicated they are, do them every time. Every step. Don't skip unless you are evolving into a more streamlined process. This is something that comes later, though, to understand the fundamentals and to later then build upon them. But starting out, this is really key. Find a rhythm, then add the harmony. That's kind of what my with doing every step every time. Find the rhythm, find that consistent pattern that you're going to approach your process, and then later on you can add some efficiency. Then later on you can focus on cost. So a lot of things about what we're doing is trying to also bring down cost and not so much waste. Starting out, that's not as important as making sure you're doing the process correctly. Know the difference between a procedure and a technique, and that will also help. What is set in stone? What is required of you versus what we are doing as much as an art. So compounding is an extremely good example of procedure versus technique. So the USP guidelines have those standards written out, but my technique on compounding may be different from another. Actually, most of our techniques are different from each other, but how we carry them out cannot be and should not be. The great thing about this field that I really enjoy is the fact that nothing is unknown and nothing is unknowable. Just like I said, everything has been defined. How we carry our processes and our tasks and our responsibilities, whether they're laws or standards or guidelines, they are available for us to know. So there really shouldn't be a whole lot of situations where we are lost or don't know a solution or answer to. And if you don't know where that resource is, there's somebody that you can ask, especially, being able to go to your supervising pharmacist, your pharmacist in charge, a lead technician. But if you find yourself in a situation where you're just lost and you don't know that that information is available somewhere. And then finally, be a sponge. So it's kind of a fun fact that sponges were the first animals to exist and have evolved over millions and millions of years since the beginning. So being a sponge, and you can too master this vast world of patient safety, quality assurance, and all that knowledge and information that you're expected to know about. You can start practicing too. But there is a reality to where you start with it and where you go with it. So I just wanted to give you that opportunity to kind of set the two apart, understand a little bit more about it. So I hope this helped. And all the best to you. And thank you for joining me.